Everybody's doing great on today, and this is the day the Lord has made, and we're here to rejoice and be glad in it. I want to welcome you to this other segment of the Hope TV. You're watching today's episode is entitled Conversations with Coronavirus Victims and Survivors. We're talking about this. We've dealt with so many different people. We've dealt with individuals. We've had conversations with persons who literally have been fighting for their lives, those who've been literally on ICU for 2 weeks, on ventilators, those who were given up on by medical science, and those who fought through. And so we've dealt with various aspects and nuances of the coronavirus conversations. And I want to thank you so very much for tuning in to this segment of Conversations with the Coronavirus Victim on the Hope TV. And if you've been helped or empowered or inspired by any of our previous broadcasts, won't you consider subscribing to the page, liking it, and following it on all things social media. We're very, very excited that every broadcast has been reaching in between 50 to 100,000 people, and so your support over the past couple of weeks has been incredible. It is our desire here to bring you programming and content that will empower and minister and uplift you from a spiritual, physical, emotional, civic, and even a financial perspective. And so our aim is to bring programming that helps us in just with our family, faith, fitness, fun, finances, and even maintaining our own faculties. And so I hope that you've been inspired, and if you have, drop a line and let somebody know that some great content is on today. You can watch today, those who are watching by Apple TV, by Roku TV, by Twitch, Facebook, YouTube, by Twitter, by Periscope. If you're watching from the edewittsmith.org page or the House of Hope Atlanta page, however you're watching, I want to thank you for your support. Your support has been incredible. And while you're watching, why don't you consider dropping us a line? Let us know where you're watching from, city, state, or the country, because it is very important to us that we bring you programming that can touch your specific demographic. So if you're watching, just drop us a line. Let us know where you're watching from. It will mean the world to us. It would certainly be inspiration to our team. They've been working diligently over the past month, 6, 7 weeks, in order to bring this type of programming to us every day. And I'm certainly appreciative for an incredible team. So while you may see my face and other hosts' face most of the time, there are some people behind the scenes who are really the heartbeat of Hope TV. And I want to certainly give a shout out to our staff, our technology department, and our media department for the incredible job that you guys are doing and helping to inspire, uplift, and encourage people during this uncharted time in our nation's history. So major kudos to our technology and to our media departments. Today on this episode of Conversations with the Coronavirus Victim, it's a little different. Our aspect of this, our conversation is going to be a little different. We went back and forth over the usage of the word victim. Is that a word we should be using? Should we call it survivors? But of course, we've talked to persons who've had their loved ones to pass away as a result of coronavirus. We've had people who, as I said earlier, who've been fighting for their lives, literally in ICU on ventilators for multiple weeks. And so that word was a word that we utilized to just deal with people who have been impacted by it, not necessarily defeated by it, but impacted by the coronavirus. And today is a nuance that we've never delved into, and I'm excited about it. Our guest today is a person who has not had to deal with the coronavirus. She's not been victimized. She's not been diagnosed with it. So praise the Lord. She has not spent any time in the hospital getting treatment for coronavirus. Thank God for that. She's not had a family member, an immediate family member who's passed away because of it. We thank God for that. And so, but what makes this conversation different? What makes this conversation different is this conversation is with someone who's actually on the front lines of the coronavirus. She is a medical director here at one of the local Piedmont Henry hospitals here on the east side of Atlanta, Metro Atlanta. And as a medical director and as an emergency room physician, she's every day watching the impact that it's had on the citizens of that community and as well as the staff. She is a graduate of Cornell University and has been practicing medicine now for 15 years plus. And we are excited that she's here with us today. She's a wife, she is the mother of 3 children, and she also is an entrepreneur in that she has 2 restaurants that she runs here in Southeast Atlanta. And so we're very excited to have with us today Dr. Tamika Blake, the medical director of Piedmont Henry Hospital, one of the hospitals here in Metro Atlanta. Hello, Dr. Blake. Welcome to Hope TV today.
Nice to see you. So happy to have, so happy that you're having me today. I'm actually at Piedmont Newton in Covington, Georgia.
Piedmont. I don't know what did I say. Piedmont. I said the wrong name. I'm sorry. So it's Piedmont and
This is,
Covington. I
yes,
got you.
it's
All right.
Newton County, and
So
I
it
live
was
in
Pete. Yeah,
Henry.
absolutely. I probably said Piedmont Henry. Yeah,
Yes.
Piedmont Henry. Yeah, yeah. I understand. That's the one that was on my mind. So I apologize for that. That's what I've been visiting as well. So I
I could
apologize.
imagine. That's
Tell us a
okay.
little bit about yourself. I know you're native of Brooklyn and
Yes,
a cum laude graduate. Yeah. So tell us about
okay.
yourself.
So I'm originally from Brooklyn. That's my hometown, born and bred, by way of Jamaican parents. I love my culture. So I've been here in Atlanta for the past 10 years. I graduated from Cornell in New York. I went to the undergrad as well as the medical school. And when I was done residency after training in New York, I made Metro Atlanta my new home. So I've been here since then. And I've been practicing emergency medicine for over 10 years. So it's really awesome. I love my specialty.
Outstanding. So I wanna ask you a question because I think it's very very important. You've been on the front lines. You've been working there at Piedmont Hospital there in Covington as a medical director. You worked as an emergency room physician. So this is what you see all day. And you can talk in terms of staff. You can talk in terms of people who hasn't actually visited hospitals. I want to kind of deal with this right from the offset. Many people are are believing that this whole coronavirus victim and all the stories have been overblown by the media. And as a result, that's Governor Kemp here in Georgia just placed a skeleton reopening of the state. Um, my question to you today would be, is it overblown from your perspective and what you're seeing on an everyday basis there in your hospital? Is it overblown? Is it something that's been politicized by the media to hurt the present administration? Um, what is your perspective in terms of the number of visits to the hospital? Is it overblown? Should we be concerned, or are we being alarmist when we try to get people to stay at home? What is your professional opinion?
So, coronavirus is not overblown. It is absolutely real. In the emergency room, we used to see everything: bumps, bruises, heart attacks, strokes. And ever since coronavirus has happened, we have had to completely rework how we do our business because it is such a contagious virus. So, and the issue at hand is we don't know much about it. We have influenza every year. We have influenza vaccines. We know that typically they're able to identify the strain and will have a vaccination to prevent people from getting the flu. We don't have anything to fight COVID-19. So it is not something where, you're going to go out into the world and we're like, oh, this is something that does not exist. The only thing we have right now is to be able to limit our activity. And that's why we've had to social distance for the past, several weeks. Because we know that when there are large gatherings, you have an increased rate of having infection and it's spreading amongst the community. So I have seen many patients that have come to our emergency department with symptoms and they're very confused. They're like, well, I haven't gone anywhere. I've only gone to Walmart. And I said, well, Walmart has a lot of people, and I'm just saying, it could be any supermarket. I've only gone to the supermarket. And there were other large amounts of people shopping at the same time. And I have to explain to them that's a perfect environment, even though you're out there getting essential items. So it's something that I really want the public to understand that this is not red state, blue state. This is a virus that does not care the color of your skin or your political party. This is a virus that has killed many people. I believe we were at least 50,000 deaths for our country. I mean, those numbers, I remember 9/11. I was pregnant with my youngest at the time. We were even near, I was in New York to look at the amount of tragedy that we have succumbed to. When you see that amount of deaths, you have to understand that this is a real virus that's affecting our community.
You mentioned something earlier that I think was so powerful and so important. One of the things I've heard, I had a conversation with a guy last night about this whole piece of coronavirus. And one of the things he said to me, and I heard it before on television, was why are we overblowing coronavirus? And when it's been proven that the flu is deadly as well, and more people have died from the flu than coronavirus, and maybe it's something that's really not as a big deal as we're making it because we don't shut everything down because of influenza. What would your response be to people who've heard those kind of talking points and just adamant about reopening because we've lived with the flu for all these years, and so we should continue and just make it through this until vaccination is found? Would you equate this to the flu? You know?
So the difference with the flu virus, every year you have scientists that study the different strains. Now, I'm not going to say they always get it right, but typically they're able to produce a vaccination that will decrease the likelihood of you getting the flu. As a healthcare worker, as a physician, my hospital requires us to get the flu shot every year. So that decreases the likelihood. And that additionally, if you get the flu virus, a lot of times, even if you got the vaccine, it decreases your symptoms and you're less likely to die from it. We don't have that for coronavirus. We don't have a vaccine. This virus has already shown that it mutates, which means it changes. So we're doing everything real time. So influenza has been studied for years. Coronavirus, yes, there have been other coronaviruses that are out there, but this particular virus is proving to show that it's not following the rules. It's not, we as physicians or those scientists, we are typically used to what we read in the textbook. It's not doing exactly what we think it should do. So that's what's making it so difficult. Now, if you equate it to the amount of deaths, when we first started, we didn't have that many amount of deaths in our country. We're saying, okay, about 60,000 people die from the flu every year. How many deaths are we at? So we're almost at the amount of deaths for the flu, and we're just getting started. There are some states that have not peaked. There are some states that infection rates are just still going up. We haven't flattened New York. It seems they have flattened the curve with their social distancing. So that should tell you that we are not playing on the same playing field as the influenza virus.
Wow. I thank you for sharing that because I think just the numbers you talk about, over 50,000 deaths, nearly 1 million reported cases now. I want to
Mhm.
ask you a little bit about a couple things about it further in terms of the testings, because we've heard that testing at one point was not going well, and we didn't have a lot of PPE or tests within local hospitals, and so the numbers that we were getting in terms of what's reported, was documented, is really not reliable data because just the numbers of people who have not been tested. Have you seen an increase in our capacity to test recently? And if so, what is that variation? What has that difference been?
So when this all got started, we have two pathways when you come to the emergency department. Typically, you get admitted to the hospital. It means you stay overnight, or you get discharged. When we first started, the patients that were getting tested were typically the ones that stayed in the hospital. So when someone would get discharged, we would give them COVID instructions saying, there's a high likelihood that you have it, but right now we are not aware of how you can get tested. And that was a very difficult conversation because patients would, tell me, well, I heard anyone could get a test. And we were, the bearer of bad news. And I used to say, well, I understand you may have heard differently, but I'm telling you, I can only speak for the facility I'm working at, the care that you're receiving right now. I don't have the ability to test you, and you're going to be discharged because you're not showing any life-threatening illness at this point. As time has gone on, we're looking at a few weeks later, what's happened is we have more ability to test, but There are drive-through testing. Some facilities have places where you can make an appointment. You can get tested where you drive up with your car, they stick a swab up your nose. And additionally, I believe CVS was having tested in the state of Georgia. So there's more, some Department of Health are testing, but it's still a fraction of our population. And just to reiterate that, Georgia has tested maybe 1% of our population. So
Wow.
we have millions of people in our state, and only 1% have been tested. So we have no idea who has it. You have to remember there is a segment of the population, and they're saying as high as 25% that may have the virus and never know, meaning they never have a cough, they never got a fever or chill. Some are reporting loss of taste, loss of smell as a symptom. They thought they were fine, and they'll walk, they're in the community, and even though you don't have symptoms, you can still spread it. So you have, particularly, they're saying that, the younger kids, they're less likely to get it, but they may have it and never know. And then they may go home, have a grandparent in the home, and all of a sudden they're sick and in ICU on a ventilator. And that's how it spread.
Wow. So how long does the testing process take, and how long does it take to typically get the results?
So when we first started, it was taking several days. There are different companies that have the test available. And now that they've increased the testing, typically within 24 hours, you can get a test result if you're in the hospital. On an outpatient basis, meaning if you go to be tested at an office or in the drive-through, that can take several days to get the result back.
I, I noticed another Emirates Airlines. They're now suggesting that they can have a test results in 10 minutes. So I've heard some variation in terms of how long those test results come back.
And
Let me.
there is another issue that we have not talked about are the false negatives. We
Wow.
have to allow as clinicians, as physicians, if it walks like a duck, sounds like a duck, it's probably a duck. So you can't allow the test to say there's no way I had it. I've had patients I've heard that said was tested day one and it was negative, and they were retested several days later and it was positive. So you're saying, well, was did they have it all along? Possibly. So there's some of the tests, could have a false negative rate of as high as 15-20%. So, and that's very dangerous because you have a patient that thinks they have a regular cold and they're going about their life, but they could still have coronavirus. So we have to be very careful with the testing and make sure that we're giving the adequate testing that gives adequate results. So if someone has symptoms, you have to make sure that you're retesting in some cases when they're really showing all the signs and symptoms of coronavirus.
I'm glad you said that, because that's something I had never even considered. I never heard about the false negatives. That
Hmm.
is that is wow. Even though you've been tested, that still doesn't mean that. So in light of that, the governor of Georgia has placed a skeleton reopening of Georgia, but we reported 26 more deaths yesterday. So from a medical perspective, how do you think that people should behave in light of the governor's decision?
So one thing I am really adamant about, if you're going in the public, you should be using a mask. And I will say, I have had to go outside for essential items, and I see quite a bit of our population without masks. And I'm not saying it's every age, young, old, middle age. And I'm just so confused by it. And I wonder, well, maybe they don't have one. Particularly in my business, I'm like, well, maybe I should see if I could get masks available for customers. Maybe they didn't have the ability to purchase one, but there should be a way to make that available to the public because we know that it's spread via droplet transmission. And I feel that the opening has to be careful. Are we opening the state for everyone? Are we going to continue to have the elderly population shelter in place? We already know that they're at a higher risk. Are you saying that they're okay to go to the barber shop and the nail salons? So we have to be very careful because the virus hasn't gone anywhere. Just because we've been at home for some weeks doesn't mean like, oh, the virus has magically disappeared. And the other issue, we don't have herd immunity. Herd immunity is meaning that we all have been exposed to the virus and we have some antibodies in our bodies. So in a way, I feel like, is that the method they're using? Let's put everyone out in the society and see what happens. Let's see if, it's really not that bad. But do we want to take that chance looking at the data, looking at the amount of deaths that we've already had? So I'm very cautious, and I think it's dangerous to think that it's okay just to open up the society without having a detailed plan.
You talked about mask earlier and the lack of you see, and I've seen the same thing too when I've gone out. Is there a specific mask that you recommend over another one?
So, if you have what we call the surgical face mask, it has like about, it feels like almost like tissue on the outside, like 3-ply. Those would be the ones that I typically use in the hospital setting. But if you have a cloth mask, that's fine, a handkerchief, something. And the key is you want to cover your nose as well as your mouth, okay? I've seen the masks where they're on your forehead, on, at the base of your neck. That's not going to help you. And when you're going outside, try to limit touching the mask. So if you're touching the door and then you're pulling the mask up to get a good fit, make sure you're fitting it to your face that you can breathe, because that's one of the things I've heard, they're having difficulty breathing, as well as speak through the mask. So you're not having to pull it up and pull it down. So if you have one of those facial masks, they're fine, but a cloth mask should be fine as well. You just need something to cover your nose and your mouth.
So when people come back home, when they've been out to the store with the mask on and have gone to get some essential items and return home, is there a process? Is there something we should do when we come back into the house in terms of discarding the mask or the clothes? Is that, because even just those basic instructions, I don't think they've been given um, in earnest. So what should be our procedure when we come back home? When you go into the store, you come back home. What should the procedure? Some type of decontamination process?
If you have a mask that the cloth mask, typically you place those in the washing machine. So the virus, is killed with soap and water. So when you take those masks off, you want to make sure you're not touching the outside of the mask so you're not contaminating it. Contaminating. And then if you have like a Ziploc bag or a paper bag, you can place it on there so you'll have it for reuse. The most important is hand hygiene. You have to wear hands. So I know a lot of times we say, well, should I take off all my clothes? If you're not rolling, on the floor in the supermarket, it's not going to be the biggest deal. The most important thing is your hands because that's what you're using the most. You want to make sure you're washing your hands both sides. And, there are different hand washing techniques where you should sing like the alphabet song so that you're actually getting a good hand hygiene practice. And then you'll make sure that you remove that mask if you need to wash it for next time. Your shoes you can leave in the garage, particularly when I'm in the hospital. Everything's coming off and I'm getting in the shower because I'm in a high risk environment where I'm repeatedly exposed to the virus.
I wanna just shift for a second because I really want to know, and I've really been concerned, and we've been doing some things to try to help, the first responders. How are you doing? How are your colleagues doing navigating this pandemic? I've been concerned. So many, in our church and in the community. You have families at home. Some of your shifts, 12, 18-hour shifts. How are you? How are some of your colleagues? Um, how can we assist you? But I want people to understand when we out there just being frivolous and can't stay in the house for a couple of weeks, that when the medical community is asking us to do this and our refusal to follow these instructions, what kind of load, what kind of pressure does it add to your workforce?
So our healthcare team, we're doing everything we can for every patient that walks in the door. So the one thing I would ask is for understanding. We have to understand that every physician, nurse, tech, respiratory therapist, our environmental services, every person that is in a healthcare environment to make sure that we can treat these patients adequately. We need the public to understand that we're doing the best that we can. And if staying home in your cozy environment is what you can do for us to decrease the likelihood of, more people dying from coronavirus. That's all we're asking. We have families that we want to go home to. I have 3 kids that I love, and they're stir crazy. They're like, why can't I go play with the friends? Why can't I do this? And we have to have long conversations. And because I'm such a high risk, I say I'm exposed every day. And I would never want you to go into an environment where suppose I had the virus and did not know, and now you go play with your friend that has a grandparent who now gets sick from it. I don't want to have to lose that. I don't want that on me. So when I give it to them in those terms, they seem to understand. But just patience and understanding. And we are doing, when I'm at work, I have my PPE, I have my gowns, my gloves, my eye mask. So I'm doing everything to protect myself so that I can make it home. But it's hard. So I ask for prayer for every single one of us that have to go every day because we're human. We can't help but understand that in a way, there be some anxiety about this. I have faith, so I refuse to allow fear to take over. But ultimately, we're human.
That's good. Thank you for sharing that. That I don't think people see it from that perspective, and that's so important. Of course, all we have all of your first responders in our prayers, and so many of us. It gets discouraging when you see so many people out just not taking the instructions and social distance guidelines seriously. But just do know there are a lot of people who are rooting and cheering for you guys on a daily basis and wanting you to be healthy, because without you, our civilization is in chaos and anarchy. So just thank you. And I want to kind of shift for a moment because we've talked about how coronavirus has affected you from a medical perspective. But as I said in the introduction of the show, you're also an entrepreneur. You're a restaurateur. You own 2 Caribbean restaurants here, Golden Crust here in
Yes, correct.
southeast part of Atlanta, and that's awesome. I didn't know that. Um, how has that impacted you? I mean, professionally and from a medical perspective and business. My goodness, that's a lot of pressure. How are you navigating as an entrepreneur in terms of your restaurant?
I will say I have a strong support network. My husband and I, are a team, and he has taken over a lot of the duties in the restaurant so that is there as much. But ultimately, I have, 2 restaurants. I have staff that do their jobs. So one thought I kept thinking is, will we have to close? You know, they depend on their jobs to feed their families. So thankfully, we have been able to remain open through the takeout option, but we're having to rework how we do business. We have decreased our hours of the store operating time because our sales have significantly dropped. And understandably, I understand why. If you're social distancing, you're not going to the lowest to get oxtail. So, but I want to remain open when this is all said and done. So I struggle because I have this unique perspective as a physician as well as an entrepreneur. But ultimately, I do not think money should trump lives. We have to do this safely. So what we've done is we do not allow the dine-in option. And I know recently, we are opening back up the state in terms of dine-in, but we are choosing as a restaurant not to do that because I do not want to put my staff at risk. I don't want to put my customer at risk. And when you eat, you have to take off your mask. So how can I, as a physician, say, yeah, come on in, have a seat, have your lunch, and I'm advising that we should be in the public with masks. Now, one of my customers could have the virus and spread it to another customer, spread it to my staff members. So it's a balance. So I'm hoping, they have a lot of programs out there. I've had some frustrations, unfortunately, with the federal program that they put out, as I know that a lot of the minority business owners, and I'm one, the funding the first round. So we're hoping that the government gets it right for the second round of funding to help us so that we can stay open when this is all said and done. We're trying to make sure that we're doing the right thing. And our customers understand they're socially distancing. We've had patrons that wait outside. And so I want to let you know there are people who are trying to do the right thing. They understand that, want to get them served, gotta eat, but at the same time, we have to do it safely.
So people actually can call in advance and then come by and pick up their orders from your restaurants?
Yes, they can call in advance. We also do some of the delivery services. We're on DoorDash and we're actually getting Grubhub set up as well. So that's been increased. So that's been helping significantly.
So it's called Golden Crust Restaurants? Golden Crust?
So Golden Crust Restaurant, one of them is located in McDonough in Jonesboro Road, and the other is located in Park Boulevard and McDonough Road in the Hampton Lovejoy area.
That's great. So now let me ask you in terms of your employees. We know your hours have been shut. We know there's no in-room dining. Have they had to take any other precautions in terms of meal prep or, has that shifted much in terms of how they prepare food now versus how they prepared food prior to the pandemic?
So we have to decrease our staffing to make sure that we're not having the large amount of, there were days, Friday and Saturdays were our biggest days. So we used to have, a lot of staff everywhere in the kitchen. And we're making sure that in the customer service area, there are no more than 2 cashiers out there at a time. So, and they're working with us. We're trying to make sure that we're taking the appropriate precautions to keep our staff safe as well. So, that may decrease our options. We may not have every single, menu that should be available. So we may not have everything available at the same time, but we're trying to keep it as standard as possible. But it's difficult when we don't have the same amount of staff that we're used to for our normal operations.
Listen, this is, I want to thank you for sharing. You've helped us. I think your heart for people, which is so refreshing to hear you say that you never put money over lives or people. That's absolutely refreshing because unfortunately, as we see, there are many people now who are in business who don't feel that way. And I just want to thank you for sharing that and putting those positive vibes and positive energy out, in the airways today. Is there anything else you want to say to us, as we bring this one to a close? And I certainly appreciate your time and your expertise today. Anything, word of advice, word of admonition, word of warning, anything else you want to say to those who are viewing this broadcast?
I just want to let everyone know that this is not a race, it's a marathon. We have to wrap our minds around that. Coronavirus is here, and until we have a vaccine, our lives are going to change. For how long? We don't know, but we have to allow the scientists, medical experts to do their job. And what we can do is be socially responsible and do the right thing. There are ways that we can protect ourselves and our families. So we're just asking that the public do the same.
I want to thank you so much, Dr. Blake. You have given a lot of positive information. You've corrected a lot of the myths and dispelled a lot of the misinformation that's out there. And I just thank you and pray for you and your family, your husband, your children, and all of your colleagues,
Thank you.
and that you'll be able to navigate these times because, in a real sense, all of us are trying to navigate, all of us are trying to figure it out while we're socially responsible. And we want to get back to normalcy, as you said, as safely as possible. And so I hope everybody who's in your vicinity of Golden Crust Caribbean restaurants will give you guys a
Yay.
call and, to get a break from
Thank you so
cooking
much.
because you're doing the right thing, that we can make sure we keep you guys afloat, and that'll take less pressure off of you so you can tend to your patients and your colleagues. So thank you so very much for sharing, and pray God's blessings on you, your family, and all of your colleagues at Piedmont Hospital out there in Covington. So thank you
All
very
right. Well,
much. Uh,
I thank you and I
Jo-
appreciate this opportunity. It's been amazing.
the, the, the honor and pleasure is absolutely ours. Family, I hope you've been blessed today by Dr. Blake. She shared some invaluable information to us to inspire us and give us hope that even in these unprecedented times, we still can get through it as we navigate, as we practice social responsibility. So I pray that everybody be strong, be safe, be healthy, and always remember this: if you will be good to God, God will be good to you. You've been watching the Hope TV Conversations with the Coronavirus Victim. Be encouraged. We'll get through this one step at a time. Until we meet again, God bless.